Good morning, Al.
Good morning, ma'am.
My name is Sophia, and I'm a therapist here in the respiratory care department. So, to my understanding, today our appointment here is to discuss COPD, just go over a few facts, what it is, maybe figure out a care plan. Does that sound good?
Sounds like a plan.
All right, let's get started. So, first of all, COPD stands for chronic obstructive pulmonary disease. And from the name itself, you can gather that it is a obstruction disease. This obstruction is caused by chronic inflammation of the airways. And actually, COPD is made up of two other disorders, which are emphysema and chronic bronchitis. And together, these two make it very difficult for one to breathe. But there's no need to feel alone because, in fact, more than 3 million cases per year emerge, and most individuals do learn how to manage and live relatively normal lives. And now you're probably wondering how you got so lucky to get this disease. Well, the number one cause of COPD is smoking. And I did read in your chart that you are a long-term smoker, but you would like to get help quitting, which I have plenty of brochures and pamphlets here that I can send out for smoking cessation. We can help you quit that habit. Also, other causes include environmental exposure. So what I mean by that is possibly living in an area with a lot of pollution, maybe a lot of smoke in the air, smog for inner cities, as well as occupational exposure, meaning if you work in a factory, if you're working in a coal mine, constantly breathing in those chemical fumes, toxic particles, even dust, over a long period of time, those will cause some lung damage. The most common symptoms that we see with COPD include wheezing, shortness of breath, tightness of the chest, frequent respiratory infections, and a chronic cough that often is productive, so you're going to be coughing up a lot of mucus. How COPD is diagnosed is often through a pulmonary function test, specifically looking at the spirometry portion. And this portion measures lung function. To perform this test, you usually you exhale as forcefully and as fast as possible into a small machine. And these results will also determine which stage you have. And when I say stage, it kind of means the severity level. There are 4 main stages of COPD. And these stages are mild, moderate, severe, and then very severe. I know that sounds a little much between, severe and very severe, but the prognosis for this disease actually is not that bad. But the exact prognosis varies person to person, patient to patient, depending on each individual's age, their general health, and their symptoms. But as I stated before, you can learn to manage and control this disease so you can live a very long and fulfilling life if you choose to do so. Moving on to treatment. So before I talk about like the pharmaceutical aspects of treatment, there will be other things you can do. Like, for example, you're going to keep an exercise diary and you're going to write down specific days what activities you're doing, whether you're just walking around the house, maybe gardening, walking your dog, and you're going to write down the level of shortness of breath or discomfort you feel in your chest. Doing this is going to help you to recognize what your limitations are, so that can help you better plan plan your days ahead. So if you know you have to do something, you can maybe break it down into time segments to give yourself a rest so you're not using up all that energy and consuming so much oxygen. Does that make sense? Also, we have different breathing techniques. We have like a huff cough, which we'll go over in person next time we meet. Purseless breathing. So when you do feel that shortness of breath, that dyspnea coming on, you kind of just like, you kind of close your lips and you breathe that way to slow your breathing to calm yourself. And then we do have, oh, actually we can send home an acapella with you, which is like this little device that you put in your mouth and you breathe into, and it's like a vibration therapy. Once you breathe into it, it sends vibrations back towards you, and it kind of shakes your airways to loosen up that thick mucus to help you cough it out.
Is that thing that looks like an eggplant?
I've been told it looks like a pickle.
Okay,
Yeah,
yeah, they sent me home with one of those already, ma'am.
Okay, perfect. Have you been using it?
Not yet.
Not yet? Okay, I do recommend that you start on that.
Okay, ma'am.
And then also we can get a regimen of a cocktail of medications going for you, which can include oral steroids. You will have maintenance medication that I will take every day. And then also rescue medications like an inhaler that you will be taking when on the days you feel so horrible and you can't breathe at all, that's when you take those rescue medications. Another thing that I'd like to talk about that often gets looked over is nutrition. Your nutrition plan is also part of the treatment plan. Now for COPD, the best nutrition plan would be a lower carb intake and a higher fat intake. And I don't really mean like fried chicken or hamburgers, but good fats like avocados, some dairy. This higher fat content will help reduce the dyspnea that you're feeling. Also, liquids. Liquid intake, water is the best thing you can drink, and keeping that hydration going in your body will help thin out your mucus, because right now it's probably thick, but with overtime, with keep drinking fluids and hydrating yourself, it will get thinner and easier for you to expel or cough off. Oh, and just for reference, I do have this picture to help explain kind of what your airways look like. So this top corner is a healthy airway. You can see that the center is patent. It's a good amount of air can move in and out of there. The smooth muscle is relaxed. And then your alveoli, which are like the little tiny air sacs within your lungs that turn the oxygen into, it goes to the red blood cells. But since you have chronic bronchitis, your smooth airways are more restricted. So they're closed, and that center is more narrow, making it harder for air to move in and out. And your alveoli, they're stretched out. That's from the emphysema portion of the disease. So instead of going back to their normal shape when you breathe in and out, they kind of just, like after stretching a balloon so long, they're just kind of floppy. Did you have any questions for me at this time?
No, ma'am, I think I'm good.
Okay, well, it looks like we're done here.
Okay. Have a good day, ma'am.
You too, thank you.